broken hearts from broken love that was meant to fill the half-empty part of the glass. Passing on down Main Street, dimming eyes, jaded smiles, fading halos hanging over broken-winged angels.
They say the truth is in the numbers. For every 1,000 live births in Kenya, 31 newborns under 28 days of age and 52 infants under 1 year of life will die. The under 5 mortality rate remains grave, with 74 deaths recorded for every 1,000 children born. Even more startling is that 26 women die every day in modern-day Kenya due to avoidable pregnancy-related complications.
No needs. So you just want a comfortable life, then we'll provide our services with all our hearts, and it will be for the better of all Kenya.
Skills and you can lead on the national office. Please volunteer.
A few years ago, a group of doctors came together to agitate for better healthcare services in Kenya. Their vision: adequate and quality healthcare provision for Kenyans, equipped hospitals, proper working environment, and proper pay for health professionals. The group settled on a name: the Kenya Medical Practitioners, Pharmacists and Dentists Union.
This union was recently registered August 30th, 2011, but the effort towards its registration started a long way back. This union has two main goals. The first one is what all other unions are about: to improve the welfare of its members, the doctors. But secondly, and perhaps more importantly, we want to improve the public sector healthcare provision. To achieve these goals, we identified the need to talk to the person responsible for providing this. This is the government of Kenya. We have tried to engage the government at various levels to try and see if you can achieve at least some meaningful healthcare, in our public sector.
The Kenya Medical Practitioners, Pharmacists and Dentists Union took head-on the mess that is the Kenyan medical sector by staging a countrywide doctor strike. This strike was to agitate for dialogue and implementation of a comprehensive medical sector strategic plan that would benefit millions of Kenyans. The strike was also meant to improve the welfare and working conditions for medical staff.
In Kenya, the judiciary is run by lawyers. Yes. Agriculture is run by people qualified in agriculture. Yes. Roads are run by engineers. Yes. Then why is healthcare run by professors of law? Yes.
Months have gone by, with the union constantly reiterating the need for implementation of the deal signed between the union and the government.
In the meantime, growth in Kenya's medical sector is retrogressing, with government after government failing to comprehensively plan for long-term healthcare service provision. The Nyayo Wards project in government hospitals singles out as the biggest achievement by government to provide low-cost healthcare. Unfortunately, the initiative was riddled with alleged corruption, inefficiency, and mismanagement. At the World Health Organization Summit in Abuja, Nigeria, African Union member states, including Kenya, pledged to increase healthcare funding to 15% of their national budgets. This was in 2001.
As far as investment in healthcare goes, we have seen a decline in funding to healthcare. In 2009-2010, we allocated 7% of our budget to healthcare. In 2010-2011, that percentage declined to 6.5%. In 2011-2012, that percentage has declined further to a total amount of 5.4%.
In the United States of America, the re-election of America's president, Barack Obama, will largely depend on his health policies, and these have already been presented not only to the Supreme Court, but more importantly, to the Court of Public Opinion. Meanwhile in Kenya, the ministries of health continue to advance in corruption and to be fossilized in status quo. Private hospitals run unscrupulously. Majority of faith-based hospitals are private hospitals in disguise. The Kenya Medical and Dentists Board, mandated with health sector regulation, are yet to fully execute their mandate. Health workers are disillusioned. Accredited medical schools are a bare minimum. Kenya Medical Supplies Agency constantly falls short in resource and medicine provision. Health laws are scanty. Newly established National Hospital Insurance Fund for Civil Servants, Police Force, and Teachers Medical Scheme is grossly inadequate and raises more questions than answers. Private insurance cover remains for the privileged minority. Public health, preventive care, early diagnosis strategy, and capacity building are theories yet to be manifest. Public hospitals are artifacts on the map of Kenya. We as a nation continue to dangerously lag behind in keeping up with modern medical advancements. Doctors' frustrations are immense, with most qualified professionals seeking better career opportunities outside the country, coupled with the emergence of quacks to fill this void.
The lack of crucial facilities in hospitals across the country, including those in referral hospitals, provincial general hospitals, and level 5 institutions, has made the dispensation of healthcare services a mockery to the Kenyan populace. Healthcare in Kenya is in the intensive care unit. In some public medical facilities, the figures are shocking, with mortality rates of 50% being recorded on a daily basis. Most of the patients visiting these institutions in dire need of treatment, unfortunately, do not survive.
For 3 days in a row now, there have been no doctors attending to the poor Kenyans in the institutions, and our government remains quiet. On Monday, we told Kenyans that doctors can stay out of hospitals, but our government will not listen. They will not listen because they and their families, they and their children do not seek healthcare in these institutions.
We must, as Kenyans, wake up and rapidly reform our health sector through drastic measures, demanding accountability and insisting on collective responsibility. The time bomb is ticking.
You want your money to be used responsibly, not to give Christmas presents to people or peremende to sulking children, no.
We are stating that we are going on strike, never to look back, even if it takes 10 years. If this is the way to change healthcare in this country, then we have to do it.
For how long will the nation's fate lie in the interest of a few individuals? Healthcare remains the responsibility of all, of the political class to meet their end of the bargain, technocrats to execute policy, and the Kenyan citizens to take care of their own health and to demand for quality healthcare services. The Kenya Medical Practitioners, Pharmacists and Dentists Union is committed to ensuring it puts to account the various stakeholders. All this before the healthcare system in Kenya reads Code Blue.